Hi, my name is Marie Briggs. I'm currently in my fourth semester of the Adult Gero Primary Care NP program here at Loyola. My presentation is the result of a concept analysis I completed for Dr. Rydosh's theory class. The subject is the concept of a good death in individuals with cancer, and the purpose is to describe the attributes of a good death from the perspective of people with terminal cancer. This topic is significant because, to state the obvious, everyone is going to die, but it's not a topic many people are comfortable discussing. In hospice, our goal is ultimately to facilitate a good death, but what does that really mean? I chose to focus on cancer because these individuals are usually of sound mind and have the ability to make plans and communicate them. I used Rogers' evolutionary method for this analysis since this is a very dynamic and interdisciplinary topic. I completed a literature search as outlined here, which resulted in 22 articles to review. I found several definitions of a good death in the literature. The psychiatrist Avery Wiseman described what he called an appropriate death as a death one might choose, had one a choice, and it means dying in the best possible way, which puts it very simply. He also touches on psychological and physical comfort in his definition. And the Institute of Medicine defines a good death as well. They mention families and caregivers and also the cultural aspect of a good death, which I think are all important points. So here I have my derived definition that I came up with after my review. And then after reviewing the articles, I found the defining attributes of this concept. I found that preferences for a good death are highly individual and influenced by many factors, including culture, religion, values, previous life experiences, and experiences with death. Um, the articles listed many very specific preferences for death that can be divided into these broader categories, which make up the defining attributes. And each one of these attributes can mean something different to each individual. So preparing can mean saying goodbye. It can mean making your own funeral arrangements or making sure your finances are in order. Relationships can apply to family, friends, maintaining a good relationship with your healthcare providers, and even online, social media, and forums. Autonomy can refer to physical independence and decision making. Euthanasia was described in a few articles, and the authors pointed out that it wasn't so much about actually um, participating in euthanasia, but more knowing that that was an option should they want to. And then comfort is the one I think most people think of, and that can take many forms that I have listed here. The antecedents are the factors or events that must be present in order for the concept to occur. And for a good death, I found those to be communication and acceptance. There must be communication from the healthcare team to the individual. There must be some level of acceptance on the terminally ill person's part to accept and think about their own death. And then there must be communication from the patient to their loved ones and the healthcare team as well. As far as consequences, those really affect the bereaved and the healthcare providers. There's a Thomas Mann quote that says, "A man's dying is more his survivor's affair than his own," which really sums it up. So the consequences for the bereaved can mean improved mental health, and this can affect their own preferences towards death. And then for the healthcare providers, a good death can result in a sense of meaning and also improved communication. So that's a quick summary of my concept analysis. I've included some references here that I used, and thanks for listening.